We're going to make foam rolling a consistent part of our pre and post workout. All right? So before your workouts, it's a great way to increase elasticity, blood flow to the muscles, break up adhesions, loosen them up. There's a lot of debate about what foam rolling actually does, whether it's beneficial or not. There's no absolute conclusion, but I do know that it helps me. It helps me sort of prepare my body for the activity I'm about to do. And also after the workout, it helps me recover. Right? So foam rolling, let's add that. So you can start in any position, but starting face down, massaging the quadriceps, right, the front of your thighs. Slowly, gently moving back and forth between your knee area and then up towards the hip area. Not actually on the hip or the knee. Slowly finding an area that is sore. Stay there for a little bit and then move. And again, there's no one way to do it. You can move back and forth. You can hang out there for a while. Right? In this case, I'm on both legs. Putting more emphasis on one leg allows me to get deeper into the tissue. And for those who haven't done it before, it'll be uncomfortable, but I promise you, if you do it more often, it'll be a lot less painful. In fact, you won't even have any pain. All right? So putting emphasis on one leg by crossing one leg over the other puts more emphasis on massaging, breaking up the adhesions, loosening up the fascia, right? All muscles surrounded by fascia, a thin layer of tissue surrounding the muscle. Think of muscles as like sausages that have casings around them, right? That casing is your fascia. And then from the quadriceps, I'm going to move on to the IT band along the side. That's the area that most people find particularly uncomfortable. So proceed with caution. For those who have difficulty doing it like I am, with the feet stacked, take the weight off by putting one foot down on the ground, the top leg down on the ground to reduce the amount of weight. And then slowly, gently, right in the middle area, all the way from the side of the knee towards the side of the hip. Again, if you find a spot that's particularly sore, just hang out there for a little bit. Okay? The IT band helps to stabilize your knee and your hip. All the movements that you perform, lower body movements that you perform, the iliotibial band expands and contracts or moves and helps to perform those movements. And when they do tighten excessively, you'll experience either knee pain, hip pain, and in some cases actually locks of the knee. So massaging your IT band is a good idea, okay? So you've got the quadriceps, you've got the IT band, and then the hamstring, right, the back of the legs. Hands placed behind the foam roller, suspended, right? You're not sitting on the ground, your butt is suspended, and then you're bearing weight on the back of your legs. Again, massaging gently, finding that sore area, stopping there for a little bit, rotating your leg at different angles to affect the hamstring in different ways. The same thing for the quadriceps, same thing for the IT band. Again, play around with the angles. And again, to put more emphasis on one leg, across one leg over the other, and get deep in there. Yeah. Cross one leg over the other, get deep in there. Yeah. All right. And again, there's no set amount of time on any one part of your body. You can do it for a minute each side, each part, all the way up to, God knows, the type of people who spend an hour just foam rolling. So, all right, now we're going to affect the glutes and the piriformis, which is right at the top of your butt cheek, right? Your glute medius, piriformis, and the glutes in general. What we're going to do is we're going to sit on the foam roller, place your hand on the ground behind it, cross your ankle above the knee, so I'm crossing my right leg, which means I've stretched my right glute, right hip, right piriformis, right? So now that I've stretched that right side, I'm going to lean to that right side, right at the top of the butt cheek. That's your piriformis. That's your shock absorber. Every step you take, every move you make, that's your piriformis absorbing the impact, right? So especially for tennis players and runners and basketball players, any sort of high impact activity that you're performing, your glute medius and your piriformis is absorbing the impact. So when those muscles get extremely tight, that's when all of your impact then transfers to the knee and the hip, and then you experience all other sort of orthopedic issues. So you don't want that, right? So breaking up or massaging the piriformis and the glute medius is a good idea. Right, on both sides, again, I'm crossing my left side, which allows me to stretch that left glute hip, and then turn to the left side, which then I'm getting deep into that tissue, okay? And then, of course, you can get your calves. For the runners and the basketball players, one leg crossed, suspended, right? You're not sitting on your butt. Suspended, not sitting on your butt. And then, the lower to mid back, right? So suspended, you're not folding back like that. You're kind of curled in like you're doing a crunch, which actually stretches your back, right? You're rounding your back in a way that stretches your back. And once it's stretched, now you're getting deep into the tissue. So I guess what that shows is, with all of these foam rolling positions, if you can find a way to stretch the muscle at the same time that you're applying pressure with the foam, you get more benefit. So even when we're face down on it, massaging the quadriceps, if you can find a way to stretch your quads while massaging it, that's even better, right? So I'm kind of rolling along the spine, along the muscles along the spine, all the way between the shoulder blades, and then all the way back towards the lower back. And as I go towards the lower back and hip area, I'm curling up into a crunch. And then laying down when I go towards the shoulder blades, and then crunch up. And it actually feels good in this area, you know? It's nowhere near as painful as it was when you were working the IT band. Now the lat / chest area, right? Your upper back along the armpits, and then rolling slightly towards the chest area. Right, so for those days where we're going to work the chest and back and the upper body, it's a good idea to foam roll pre and post. Right? And then for the tennis players and the volleyball players, those who sort of generate a lot of arm speed, you know, your lats and your triceps and shoulder area tends to get really sore. Right? So again, there are many more positions and muscles that you can use the foam roller for, but those are the basics, right? Quads, IT band, hamstring, glutes and piriformis, calves, muscles along the spine, and the lats. All right, try to get that done pre and post, one or the other, if not both, okay?